Assalamu alaikum.
Waalaikumsalam.
How are you?
Alhamdulillah, good.
All are okay, alhamdulillah.
Alhamdulillah.
Okay, let us start by al-Kitab. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين. يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط Who will be the first to present?
Maisara.
Okay, Maisara will be the doctor or the patient? Hello?
I'm sorry, what do you mean by doctor or patient?
Doctor, you mute your microphone.
Doctor, you mute the microphone. We cannot hear you.
Okay. Okay, let us start by the first case.
The first case is about 3-year-old Malay boy. The chief complaint is 3-year-old Malay boy presented.
Can you increase the volume, please? I cannot hear you.
Okay, sure. Is it clear now?
Just speak louder lah. Speak louder.
Okay. So it is entered to emergency department of HTAA with complaint of rashes and knee swelling for 6 days. Clear tak? Clear tak? So the history of presenting illness. So the patient apparently well until 6 days prior to admission, when the mother.
So sorry, you will present the case.
Yeah.
Yes, doctor.
So I need to assign another one. Will get the history from you, please.
Oh.
You will be the role player as a mom. And who can raise his hand, please, to be a role player?
Alif.
Boleh? Okay.
Boleh, inshallah, I'll try.
So now you are present in the emergency department. And here is a nice mom coming with her child. Please, you have 20 minutes to ask her about the history and she will tell you everything.
Just give me a minute. Yeah.
Okay.
All right. Okay. Okay. Shall we begin now, Masalah? Okay.
Okay.
Doctor, should I speak in Malay or English?
English, please.
English. All right. Okay. So, Assalamualaikum, Puan.
Salam.
So, what is the reason that brought you to this hospital?
So as you can see, my boy right here.
Okay.
So he's complaining of having rashes.
Rashes.
Um, it's not. I noticed he has rashes for
Sorry. For how long duration?
6 days.
6 days. Okay. So
Yeah,
what is your child's age?
3 years old.
3 years old boy. Okay.
Yeah. So apart from the rashes, I also
Okay.
noticed that his gait was quite abnormal.
His gait.
Yeah, yeah.
What do you mean by his gait?
The way he walks. I'm sorry.
Oh, okay. His gait was abnormal. So, since when that you noticed his gait was abnormal? Is it
Six,
from okay?
six, 6 days.
Also 6 days.
Yeah, yeah.
Okay, accompanied with rashes, right? All right.
Actually, before the before that, I did not notice the rashes. So
Okay.
when I looked, the way he walks is quite abnormal. So I looked
Mm-hmm.
at his knee.
Okay.
The knee is the knee swells, and then there's also rashes at
So,
his foot.
at his foot. So,
Yeah,
so the rashes only at his foot.
yeah.
For is there any rashes on his hands or arms, face, other parts of the body?
Um, this is 6 days ago. So
Okay.
lately, yeah, the rashes also present at his buttocks and also um other parts of the legs lah until the buttocks.
All right. Okay, I see. All right. So, is your child well before this? Is he having any fever or any sickness prior to these symptoms?
There's no fever, and
Okay.
also apart from the way the abnormal walking,
Mm-hmm.
all that. But
Okay.
after the way after he walks quite funny, and
Mm-hmm.
then he also complained of having pain at the knee area, and then yeah, because of the pain, and then he cannot play with his friends lah.
Right. All right. So, is there any symptoms that your child complain, such as abdominal pain,
Oh,
or
yeah,
okay,
yeah, yeah. He's
yeah,
also having abdominal pain, but
okay, okay.
only one day,
Only one day. So
and it yeah, okay, yeah.
when is it? I mean, is it the first day of the rashes come out, or yesterday? So,
Um, Yesterday.
yesterday. Okay.
Yeah.
So, how did he describe the pain, abdominal pain? Is it a very burning pain, or is it like increase and decrease in pain?
I don't know. He's just 3 years old, so what do I
Okay,
expect from him? So he just
okay,
say that he has abdominal pain. So
okay. All right,
I don't know
okay,
whether it's burning or not.
all right. Okay. Um. So did you notice where is the region of the pain on his abdomen? Is it at his center of the abdomen, or is it on the right or the
Left,
left?
left, left side.
Only on the left side.
Yeah.
Okay. Left side. So did your child take any medication to relieve the pain?
Um, because of the knee swelling, so I went to
Okay.
clinic kesihatan,
All right.
and he just gave paracetamol
Mm-hmm.
and also
Sorry, I can't hear you. And also.
paracetamol and topical cream.
Topical cream.
Just cream,
Okay.
and only minimal improvement.
Or for the rashes.
Topical cream. I'm not sure what the topical cream.
So does the PCM did relieve the pain that your child is suffering?
Just a little bit.
Just a little bit. All right.
Yes.
So apart from that, is there
Mhm.
any abnormal condition that your child is having, such as he might say that he have a blood in his stool, or any difficulty in passing the stool or urine?
No, there's no problem with that.
No problem with that.
Yeah, yeah.
All right.
It's okay with that.
So so did you know that your child might be complaining of having red urine? Is there abnormality with the urine?
No.
No.
Yeah, it does not complain
Uh,
anything.
okay. So so apart from the rashes, abdominal pain, and
Mhm.
also abnormal gain,
Yes.
is there was any symptoms that you notice on your child?
What do you mean by that?
Any condition, such as did your child have any runny nose, sore throat?
No. Oh, but he also have edema around his eyes. So that's all.
So you notice the swelling on his eyes.
Yes.
All right.
Mm-mm.
So may I know what is the duration of the swelling on his eyes?
I would say around 3 or 4 days.
3 or 4 days.
Yeah.
Hmm. Sama tu lah aku sama. Alright. So just, okay. So is there is anything that I should know from your children? Is there is any complaint from your children, from your child?
Mm, I guess the
Okay.
swelling is painful.
Alright. So this one is painful.
Yeah, when I touch the swelling, it's a bit warm than the other parts of the skin.
Warm. So may I know, is it bilateral or unilateral?
Um, for the first time, I noticed it
Yeah.
unilateral. Then it
Okay.
went other knee also. So it's now it become bilateral.
Bilateral. So knee swelling only. So did you notice any leg swelling on your child?
No,
No.
there's just
Alright.
rashes at the legs and
Alright.
also the.
Any rashes? Okay. I would like to ask you about his birth history. So,
Yes.
was there any complications during your pregnancy, during your
No,
delivery? No.
no, no.
Okay. So,
There's
may I ask what is your child's weight during he was born?
2.4 kilogram.
2.4 kilogram.
Yes.
All right. So, as for his developments, was there is any delay in his walking, talking?
No.
No. So
Yeah.
it seems that everything was normal, right?
Yes. Yes. Everything's fine.
Okay, it was fine. Okay. So, in terms of his food intake, is he a
Mm-hmm.
picky eater?
No.
No. Um, so at his current age, what can he eat right now?
Rice, chicken or fish, and
Chicken,
vegetables.
right?
Yeah.
So,
So
like
he's
a
not a
norm.
picky eater. Yeah.
All right.
He takes adult diet.
All right. Okay. Oh yeah. Uh, apa lagi satu sama? Birth, birth nutrition.
Vaccination.
All right. So for vaccination, is your child having proper vaccination according to his
Yeah.
schedule? Right.
the vaccination is complete.
All right. Okay. So I would like to ask, is this the first hospitalization for your child?
Apart from after I gave birth to him, so he's having jaundice. So he was warded a week. So and that's the first hospital admission, and this is the second one.
So the first one with is related with the jaundice for 1 week, right? Okay. And then this is the second one. Okay. Yeah. Yeah. May I know how many siblings that your child have? That you have?
I have or
Yeah.
my son?
You have. I mean, how many siblings that the child have?
Oh, okay.
Okay.
Two.
Your children.
Yeah,
Two.
two.
Okay.
He has older brother.
Okay. He has older brother, right?
Yeah, 5 years
So
old.
okay. So does his brother have similar symptoms like him, or he just
No.
doing well?
No.
Right. Okay. Mm. Okay. Yeah. So may I know your age and your husband's age?
So I'm 28.
Okay. And your husband is?
7.
Okay. Um, so was there any family members with similar symptoms that your child was experiencing right now?
No.
No. So only
Yeah.
him.
Yes.
Okay. Mm. So before that, so your child complained about having abdominal pain, right? So does he also tell you of having any nauseatic condition, any vomiting?
There's no vomiting,
There's no
and
vomiting.
he's fine. Yeah.
Okay. Okay. So I would like to ask, apart from the PCM and also topical cream that the clinic gave to you, was there any medication that you give to him?
Just PCM.
Yes. Okay. Only that lah.
Uh,
Okay. Sabar tu. Uh, apa lagi lah? Mai, apa lagi Mai?
Okay.
Was there anything that I missed?
Okay.
oh, sure.
Sabar.
Okay. Right. Just trying to help. Okay. First of all, based on the question from my friend just now, so you mentioned that before that, may I know what's the name of your boy?
Paris.
Faris. Huh? All right. So you said Faris have rashes, and he kind of walk. The gait is quite abnormal for around 6 days.
Sorry,
Yeah?
why you interrupt your colleague? It is his turn.
Okay.
Sorry.
I'm just asking for his help.
Okay, continue, please.
All right. So was there anything that you want me to know?
I guess there's no.
There's no.
Yeah, that's it.
Okay.
Okay, that's one thing.
All right.
The patient grandmother had been diagnosed with
The patient's-
intestinal. Patient's grandmother
Okay.
diagnosed with intestinal cancer. So, yeah.
May I know her age?
When diagnosed, or
Yeah, when it is diagnosed.
I actually can't remember, but I think it's about
Okay. So also, I want to know where is your house location? Where do you live?
Camp Galing in Kuantan.
Okay. So did you notice any recent fogging or any cases related with dengue in your area?
No.
No.
Yeah.
Okay. So is there anything that I should know from your story?
I guess that's all.
That's all.
Yeah.
Okay, that's all. Okay. Okay, okay, doctor. Okay.
Okay. Anything else do you need to ask about?
Mm, I would like to ask about is there is any allergy to anything for your child?
No.
No, no allergy. Okay. So I guess that's all of that.
Okay. Thank you. I think this is an important lesson to all of us. I need you to start good. If we start good, inshallah, we'll continue like that. Okay. I know that lockdown affect face-to-face contact with your lecturer, but let me comment for simple things. The first, what is your diagnosis? Not you, my Sarah, for him. What is the diagnosis?
So in my opinion,
Yes.
it look like he not showing purpura.
Okay. Why?
Why? Because depression. First, it has rashes, and also complain of the knee pain, and also complain of having abdominal pain. Because sometimes it has involvement of the renal in HSP.
Okay. So it is just simple HSCP, or
Sorry, simple or?
is it simple or looks like complicated? Any diagnosis, you must ask yourself, is it simple diagnosis or there you suspect any complication from it?
So based on history itself, I would think it is simple. But however, we need to look upon in physical examination.
Okay, if I said you, for me, it looks not simple.
Simple.
So not simple. What?
Sorry? Doctor?
Yes, what can be the clue for that?
Sorry, doctor, can you repeat again?
If I informed you, it is not
Okay.
simple.
Okay.
So what can be the clue?
Not simple.
What is the complication which you suspect? If I told you simple, that there is no complication. So what complication did you suspect in that scenario?
Glomerulonephritis.
Mm. And who can share with us, please? We have 11 participants now. What is the most common complication for HSB? Anyone can raise his hand, please, or share with us.
If I'm not
Looks,
mistaken,
no. We must get outside from this cycle. I need the other participants, please. So,
Interception, Doctor.
Akila, sorry,
Interception.
interception, very good. So what is the signs of interception?
Abdominal pain. Colicky abdominal pain.
Number one, abdominal pain. Then,
Nausea, vomiting.
please increase your voice, please.
Nausea, vomiting.
Yeah, so this is a good point. Yes. Why the patient got abdominal pain? Anyone knows? Why the patient got interception also? Maybe looks like the same cause. Yeah, usually it is related to vasculitis itself. Okay, vasculitis make like simple decrease in the blood flow to the gut, so it will cause pain. At the same time, if this vasculitis cause heaviness in a part of the small intestine, so it will be invaginate inside itself. Okay, so it will cause interception. So the patient, if the patient complain of abdominal pain, the most important point to rule out any interception. Thank you for this one. Any other can tell us other complication? Hello?
Is it Elias? Paralytic Elias?
What else? The mother told you that her child got puffiness of the eyes. What can be?
Nephrotic syndrome.
Sorry? I
Nephrotic
cannot
syndrome.
hear you.
Huh?
What can be the cause of swelling or puffiness or edema?
Nephrotic syndrome.
Hmm?
Nephrotic syndrome.
Yes, so can be complicated by nephrotic or whatever affection of the kidney. So it is very important. Any disease, we must ask ourselves many points. What is the diagnosis? Okay. Number two, any diagnosis, and please try to concentrate for that, has like root and fruit. What is the cause of this disease? Sometimes it is primary or secondary. Okay. It means this patient has SLE and complicated by these signs, okay, like nephrotic or other. And is there any complication or not? So if I need to come to diagnosis, I must ask myself, what is the root and what is the fruit? Is it primary disease? Okay. If it is secondary, I will ask myself, what can be the cause? Second thing is there any complication or not? Because all this will help me to get the accurate decision in the accurate time. Okay? The second and the most important, don't try to accept one diagnosis in your life. You must ask yourself always, what is the differential diagnosis? So who can suggest another diagnosis?
How about hand,
Let's
mouth?
concentrate with fever, with rash and arthritis.
Can it be dengue fever?
Dengue fever. Okay. Dengue fever, I accept from an important point, which we must be very wise with it. Any endemic disease, we must rule
Doctor,
out.
how
Okay.
about hand, mouth, foot disease? HMFD.
It is not so famous with arthritis. But dengue sometimes, or leptospirosis, can cause rash and joint pain. Especially leptospirosis can make pain sometimes in the joint, sometimes in the muscles. Okay, so if we have every area of the world have its own diseases, and we must consider it in every patient to come to us. Like if the patient came to you, even this patient, you need to write treatment for him. You must ask him, do you have G6PD? Why? Because G6PD is very common. Because I may wrote for him drug which causes hemolysis. So came for a problem and I add extra problem for him. As your colleague asked, has any allergy? It is very good also, the same concept. So you said can be some inflammatory disease like dengue, leptospirosis. I need extra inflammatory disease because in your medical career and hoping inshallah the best for you and see you in the best. Now you are starting, but you have about more than 1,000 days. You will practice clinical. If you didn't put yourself a good concept, if every day you saw one patient, at the end you have at least 1,000, 2,000, 10,000 if you are keen to see a lot of patients, and you will be at that time a knowledgeable person. Okay. Other disease which cause joint pain and arthritis.
Doctor, how about SLE?
What about your microphone?
Hello, test. Okay. Doctor, how about SLE, systemic lupus erythematosus?
I cannot hear you.
SLE.
What is the problem?
I'm sorry.
Raise your voice, please.
I think maybe this patient have SLE, systemic lupus erythematosus.
If someone hear him, you can translate his message, please.
SLE, doctor. SLE.
Yes.
Systemic lupus.
Okay. SLE, yes. I consider that because SLE, but it is not infectious, Samba. It is not infectious. SLE is a form of systemic vasculitis. Okay. So it is very important to differential diagnosis. Thank you. But now let me guide you how to think about the diagnosis. If you remember your basic medical science, they teach you in the pathology can be inflammatory, can be malignancy, can be autoimmune, okay, can be vasculitis, can be traumatic. So you must work with the same knowledge. They are not wasting your time. They are trying to give you a basis how to think about any patient you saw him. So if we are speaking about infection, I will just try to ask you, anyone knows rheumatic fever? Who can answer what is the criteria for diagnosis of rheumatic fever? Yes, Noor, Hafiza? Hello.
Hello, Doctor.
Hello, Doctor. Criteria for rheumatic fever.
Just a while. Just a
And
while, please.
the Jones
Try help you.
Jones criteria.
Yes, John's criteria. Thank you. So, can you remember? It is major and minor.
Minor.
Minor criteria.
Yes, for the major we have.
Joint
Polyarthritis.
involvement.
Okay. What else?
Myocarditis. Myocarditis.
Okay, we have carditis, whatever myo or peri or endo. Okay, what else? Arthritis.
Subcutaneous nodules.
Yes, so we come now for arthritis and the subcutaneous nodules. And erythema.
Vaginatum.
Yes, so you have now two criteria in the skin and the arthritis. So it may be rheumatic, still can be, okay? Inshallah, with time when you will see some patient who got some parasitic infestation and the bugs and like that, orang asli or coming from remote area or from other countries, you can hear about Lyme disease, which also a skin rash and arthritis if not treated. Lyme disease, if diagnosed and treated area, it is easy. If not treated, it will turn to a bad, maybe destructive arthritis and CNS affection. Okay? Another autoimmune disease, as your colleague speak about SLE, but there is another autoimmune disease like
ITP.
very good, IBP. What else? Very common chronic arthritis with skin rash. Anyone knows about rheumatoid arthritis in children, which we call as juvenile chronic arthritis? We are not said it is like adult rheumatoid because most of our cases are rheumatoid negative, but it is rheumatoid. But we are trying to choose our names, so it is juvenile chronic arthritis. How many times? We will know many times, but one time is the systemic onset. Systemic onset juvenile chronic arthritis will come with rash and arthritis also. Okay? Very simple, like some diseases, infectious disease. Let us speak about like mumps. Can cause arthritis also. Sorry, like measles. No. Rubella. Rubella is very famous with arthritis. Okay? So it is very important. Some common cold and skin rashes can cause something known as reactive arthritis. It is just reactive pain, which will disappear soon. Okay? Some chronic diseases can cause also arthritis, like inflammatory bowel disease. You may hear about Crohn's disease or ulcerative colitis can present. But the most important, which we mustn't forget, the presentation of malignancy are very subtle in many patients. So leukemia, which is the most common malignancy in childhood, ALL sometimes presented by skin rash and arthritis. So now we can understand the importance of pathology. It is not good for anyone to throw these books of basic science. Even when you come back to your master, we will start again examining you for that. And when you go for your membership, the first part, which most of the candidates fail in it, is the basic science, okay? So the important lesson for us now, number one, Ayman, we must be able to have a flow for everything. I know that I begged you without preparation, but this is the best way to teach you, okay? Because as I told you, whatever it is, 1,000 days or less or more, and you will be graduated, and you are hurry, I need to start my work, wait, let me wait for 1 month or 2 months or more or less. But when you start work, you will not choose the patient. You will sometimes catch your head, oh Allah, malignancy, oh Allah, this is that rare disease, that is a problematic disease, this patient in shock, this patient in trauma, this patient in malignancy. You will not choose, and you must be ready. So start from now. Every patient you see, you must make documentation, and you must make some background, which if put it together, it will make you a good clinician. And if you're a good clinician, that is the way which you are a good doctor. Which you can give benefit to your community. So number one, for the history, we must be very systematized. We must ask about the symptom. I think all of you did short case, I think, before, and knows the items must go one by one. Don't escape, because if you escape some points, you may lose many important clues. Okay? So you must be systematized during history. You must know what is the complaint, what is the presenting symptoms, what is the past, what is the other systems, what about his vaccination, what about his growth and development, what about the family pedigree, because a lot of candidates miss that during practice, and it is not good. Okay, I used it to tell you, like family pedigree must be done, like the growth chart must be filled. Beside it, growth and development, the vital sign, they call it vital sign. It means it is vital. You cannot forget it. Okay? The social history is very important, as your colleague try to ask how many child do you have, or like that, but you must ask what is the job, how is the income, where you are living. All this can give us a clue. Okay, am I clear? For that, so number one, I must try to put a frame for my initial diagnosis. And even if I am very lucky to diagnose, even simple diagnosis, like tonsillitis. One of the most common will be the patient came with fever and sore throat, and you open the mouth, you found the two big tonsil, kissing tonsils, and there is follicles and like that. Is it enough? And I will be very happy for that? No. Also, I need to ask myself, what can be differential diagnosis? Because even if the inflamed tonsil can be bacterial and can be viral. Okay, it is very important. And it can be what types of virus, I must ask myself. It may not be not simple tonsillitis, but it can maybe like tonsillar abscess, which is life-threatening at this area if I didn't diagnose and refer. And at the same time, is there any base for that? Like if this patient like immune deficient, have abnormality, has repeated infection, I must ask myself, what about his growth and development? It maybe have limited growth and limited immunity. And is there any complication? Because tonsillitis can cause rheumatic fever. Okay, I know that it is not during the acute attack, but it may be after 10 days or 2 weeks, fever subside and came now, and now we're starting another. So even the simple diagnosis, it is not simple, and you mustn't make it simple. I agree that we must make our our patients panic, but this doesn't mean that our mind also be superficial. Okay, so this is the most important point for our teaching. For the first case, number one, be systematized during your history taking, be systematized during your examination, be systematized to collect the diagnosis, put your diagnosis, is it has a background for this, as this patient got SLE and then he looks like now another disease, nephrotic or Henrichon line like that. The second thing, is there any complication? Because sometimes most of the patient of nephrotic syndrome, how many of them will come to us because of Cushing disease, because of the steroid side effects. Okay, at the time his face is not so puffy and is not complaining of extra fluid, but he is thinking to cut it, and sometimes he is dependent or resistant or whatever. So you must know also what is the complication which we suspect, and we must manage it. Like Henrichon line berbera, which is a type of vasculitis. Okay, and which organ can be affected? Anyone can answer? I don't know who is attending with us today. It is only 3 or 4 persons. If you are not going to chair, I will make you absent. Sorry. I will choose myself. Lina. Lina,
Yes, Doctor.
are you around?
Yes.
Can you summarize what I said, Lina?
Sorry, Doctor. My internet connection is not really good. What you're saying, it's sekat-sekat.
But your voice is very clear, Lina. You didn't pick any point which you are speaking about?
I heard just now about the health patient come with nephrotic syndrome, but they come actually with a complication of steroid.
Okay, so this patient has Henrichon line berbera now. Okay, Henrichon line berbera, did you know which organ can be affected, Lina?
HSP.
Yes.
Among the organ that can be affected, one is renal, which can lead to nephrotic syndrome,
Okay.
and then intestinal.
Okay. Very good.
And it could be CNS involvement as well.
Good.
And hypertension.
Hypertension due to kidney affection.
Yes, due to RAS activation.
Very good, Lina. What size of vessels will be affected in Henrichon line berbera?
I'm not sure, Doctor.
Who can answer? We have a small vessel, we have a moderate, we have large vessels. So you need to come back and ask yourself, if I got vasculitis, I must know what is the size of the vessel, because it has different, they have different presentation, okay? But the thing which I need to remembering you now, that if it is vasculitis, so it can affect any cell in the body. There is no cell without vessels. There is no cells without vessels. Okay? So it can, as you said, affect the abdomen, affect the joint, affect the skin, affect the kidney, affect the brain, affect even testicles, can affect any part in the body, can get some complication. That's why you must be very keen, because if we pick it early, we can diagnose. So I leave for you now Henoch-Lang berbera, with consider it as an important point for you, with its differential diagnosis for fever and arthritis. You must be able to put for everyone the most characteristic point which we can diagnose. Like if rheumatic fever, I need the history of streptococci. I need presence either 2 major or 1 major and 2 minors, like that. Okay. Am I clear?
Yes, Doctor.
Okay. Any question?
No, doctor.
So we need to come to Maisara now.
Yes.
Maisara.
Yes.
So suppose you are the one who is going to present at the start. What is the diagnosis, Maisara?
Doctor, can you hear?
Yes, I can hear.
Yeah.
What is the diagnosis?
Henoch-Lang purpura.
With
Sorry.
presented by many organ. How many organ are affected?
The skin.
Okay.
The skin. He also having abdominal pain, so the intestinal.
Okay.
And also the joints.
Okay. You said there is puffy eyes.
Yeah.
So it
it's renal. Can be renal.
Can be renal. Okay. How can you diagnose it, Maisara?
The criteria of based on the criteria.
Yes.
The first criteria is palpable purpura,
Mm.
in which the purpura is non-blanching.
So it is very important. Thank you. For any rash, we must define, is it blanching or non-blanching? Remember this in your life. If you find non-blanching rash, you must be very, very careful, okay? Because it can be severe infection, it can be vasculitis, it can be malignancy, like that, okay? What else?
Abdominal pain.
Okay.
And also the age group of the children, in which less than 20 years. And the last criteria is diagnostic of the biopsy, in which there's granular sites in the wall of arterioles and venules. So there's IgE.
So now what investigation you will do?
First, the important is the full blood count.
Okay,
In which
Mm.
full blood count, so we look to the white blood cell. So in HSP, so it is to differentiate whether whether it is due to when we look at white blood cell to look if the white blood cell is reduced or increased or normal. So if the white blood cell is reduced, then it can be due to leukemia or other. So, and also thrombocytopenia, where we look at the platelet. So in HSP, the platelet is either normal.
disease in which have thrombocytopenia. So we can also do urine analysis to screen for evidence of hematuria. So to look whether there's microscopic hematuria.
Okay.
And we do renal profile to check if serum blood urea nitrogen and creatinine. So it can evaluate the renal function and to check if there's any electrolyte imbalance. So liver profile. So just a baseline to investigate the liver function. We do ESR or C-reactive protein.
Okay.
And also because of the patient having abdominal pain, so we do stool or cut blood to test if there's any blood in this stool. So it is to identify if there's gut ischemia, as in HSP there might be gut ischemia. And also abdominal X-ray to rule out gut perforation and also see if there's any interception.
Okay, that's good. But any of this is diagnostic for HSP? What is the diagnostic tests? It is one you mentioned in this a big dilemma.
Mm-hmm.
What is the diagnostic? Is the skin biopsy.
Skin biopsy. Okay.
But are we doing skin biopsy for all patients? Usually
No.
not. So why you are doing all these investigations? Usually to rule out others. That is bring us again in the same point which you are discussing. Our goal, because this disease is diagnosis of exclusion. I have criteria, but I need to exclude. Okay, is it other disease, either inflammatory or malignancy or vasculitis or whatever, or not? So we came to the same cycle. Our journey with the medicine is not spot diagnosis. Must be your mind full of details. What can be the cause and what I must rule. Because it may be this patient have hidden dangerous disease. I know Henry purpura is a good prognostic disease. Okay, but sometimes it is difficult to pick it. Okay, you just let me remember a long time while I was in my master examination, I think, yes, they bring for me a lady which is completely covered and just a bare hair joint with arthritis. So what can be cause? So I'm trying to search. Yes, there is arthritis, unilateral. Is it septic arthritis? She has no fever. Is it juvenile chronic arthritis? So once I started to see, I found simple rashes. At that point, I tell them I need to cover the to examine the back of the lady. Typical rash of Henry purpura. Okay, at the time we can start to rule others. Okay, so I'm trying to rule other. Is there any hepatosplenomegaly because it can be signs of leukemia? Is there any other problems? So I told the examiner at the end, it looks like Henry purpura. At that point, the examiner have a trouble with the patient. The mother cannot accept it is just. So tell me, you can inform the family about that? Tell her, okay, Mom, I would like just to inform me this a form of inflammation of small vessel. It can occur in many diseases, but we can come to the diagnosis of henochulal berbera, which is usually has a good prognosis, but we must take care as some complication can occur, and we need you to be attached with us at least 1 year to follow up her blood pressure, to follow up her urine, her like that. Okay, she became settled, and I passed the exam because the mother heard the same message from more than one. Even he told me thank you at the time. That's why some diagnosis usually during our clinical practice is a exclusion criteria. I must rule out every patient coming to me. I must ask myself, is there any hidden severe disease which I need to diagnose it early or not from the list? Okay. Now, who will present with us the OSCE? Are you?
Doctor.
Yes.
No, I asked you yesterday. So you said that we just need to present the typical long case. I did WhatsApp you on yesterday.
You are trying. I am trying to help you, and they are not trying to help yourself. Every case must contain our OSCE. I send you the diagnosis, and you tell me you have your own. Any case, because now we don't have live patients, so you must make non-man OSCE for every case presented to me, please. Am I clear?
Yes.
So next time you need to assign someone to present for us some non-man OSCE for joint pain and arthritis, which we speak about. Okay, it will be very short and straightforward, not time consuming, very important. Okay. Your turn now. Do you need to ask any question before starting the second case? Other colleagues? Okay, so let us start by the second presenter. Also, the presenter now will be the mom, and we'll assign another candidate to get the history from here.
Can I try?
I need to see new candidates. If no one raises his hand, I will choose. Participants, Bismillah. Siti Noor Aisha. Hello.
Yeah.
Okay, you are going now to speak to the mother about her case. I will offer you 20 minutes, please. Try to concentrate. As I told you, you must get the signs and ask the symptom and the signs, and try to ask for extra detail which help you to put a diagnosis, and you need to ask more questions about the other possibilities or other differential diagnosis. Okay?
Okay.
Okay. Please, your voice or your computer need to increase the volume, please. Okay. Go ahead. And you have 20 minutes.
Okay.
Okay.
Assalamualaikum Puan. Okay. What makes you come to the hospital?
Sorry, I cannot hear you.
Uh, I already unmute the audio. Can you hear me?
Yes.
Yes.
Okay. What makes what makes you come to the hospital?
No, number one, you must ask anyone here his name, her baby's name. Why
Okay.
you come? You must tell her welcome. Can I know your name? Okay.
Okay. Okay. Assalamualaikum Puan. What is your name?
My name,
Ye-
my name or
yes.
my child?
Okay. Your child's name.
My child name
Your
is
child
Afan.
Afan. Okay. Why? What is your son's problem?
Oh, my son had diarrhea and vomiting for 2 days.
Okay. How old he is? 3 days, right? Okay. How
He is 2 years old.
uh is it boys or girl?
He is boy.
Okay. Uh okay, boy. How old? 3 years old.
2 years old.
2 years old. Okay. Okay. Can you explain more on the diarrhea? How how often in one day and so on. Can you explain more about diarrhea?
So the diarrhea was described as watery with
Watery,
a semi-solid stool, and
yeah.
it was brownish in color, and it was overflowing from the diapers.
Okay.
And there
Yes.
was no blood in the stool,
Okay. Okay.
and the diarrhea happened for about 10 times per day.
10 times per day. Right. Anything more? Anything about diarrhea? Uh, Usually, when the diarrhea happen, is it more in morning or night,
Oh,
or it doesn't? Uh,
it doesn't have pattern.
okay. 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 After having diarrhea, how can you describe your son's condition?
Sorry, can you repeat again?
Sorry. After your son having diarrhea, how can you describe the conditions of your child? Is he lethargy or less active or and so on? Can you describe more?
Yes, I noticed
Yeah.
that my child appeared lethargic
Lethargy.
and he refused to eat.
Refuse to eat. Is it for the 3 days?
Yes.
Okay. Um. Okay. Do you notice any of anyone have same problem as him?
Oh,
Are they siblings or
there is no sibling
no?
that have
No
the
what?
same symptoms.
Okay. Mm. Or do you notice he had taken any outside food or buy food from uh stalls beside the road?
No, we usually eat
Okay.
at home.
Okay. Okay. For the vomiting, is it for the also for the 3 days?
Yes.
3 days. Okay. When can you describe more about the vomiters?
So the vomiters consist of food particles and also milk.
Okay.
The amount was about half cup.
Okay. And any more about the vomiting or vomiters? Is it projectile or non-projectile?
It is a non-projectile, and he
Yeah,
vomited about seven times per day.
7 times per day. Usually, your child vomit after a when? Is it after a meal or suddenly?
Usually after having meals, but
Okay.
later on, he can cannot tolerate orally due to frequent
Okay.
vomiting.
Is there any blood in the vomiters or greenish color in the
Oh, there is
vomiters?
no.
Okay. Uh, um. For the 3 days, do you seek any medication or did you go to any clinic to seek for treatment?
Oh, on second day of illness,
Okay.
uh, um, we brought him to clinic,
Yeah.
and we was given suppository paracetamol
Okay.
because at that time he had fever.
Uh, Now does he had a fever? He has fever?
Uh, yes,
Still has fever.
yes, still have fever.
Okay. Uh, You said that on the second day, you went to the clinic and doctor prescribed the PCM. Uh, does the PCM relieve the fever?
Uh, it relieve the fever for
Yeah,
a bit.
or be is the fever occurred for the 3 days?
No, it happened on the second day of illness.
Second day and today, right? It means that the diarrhea and the vomiting happened first, and then on the second day, uh, there was fever, right?
Yes.
Okay. Can you describe more about the fever, about the pattern, about the grade, or do you measure the temperature at home?
So I did not record the body temperature at home.
Yeah.
Mm, I think that he was warm to touch.
I wonder that. Do you notice that whether the fever high in afternoon or maybe at night, or is it the same pattern?
It is the same
Okay.
pattern.
Do you notice that your son have chills or rigor?
Oh, there is no chills and rigor.
Okay. Um, you went to the clinic on the second day.
Yes.
It means that your son had already had diarrhea and vomiting. And does doctor prescribe any medication for the diarrhea and the vomiting?
Oh, yes. After we went to the clinic, So the
Yeah.
doctor there referred us to HTAA, and we was given the oral rehydration solution and was discharged.
It means that the
But the next day, I noticed that my child become worsen and not improve. So we went again to the HTAA.
okay. Yours already receive ORS.
Yes.
Okay. Um, Instead of fever, vomiting, and diarrhea, is there any other symptoms or problems that your son had?
I think there is no other symptoms.
Um, uh, your son is 2 years old. It means that your son still wearing diapers, right?
Yes.
Okay. Not yet toilet training.
Yeah, not yet.
Okay. 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 Did he had any contact, any sick contact, with maybe with his siblings or at nursery maybe?
Can you repeat again?
Okay. Did your son had any sick contact, maybe with the siblings or parents or anyone in the house or in nursery?
Oh, I think there is no sick
No sick
contact.
contact. Okay. I want to ask about okay, your son still drink milk, right? What,
Sorry.
still drink uh uh did was are your son still drink milk?
Yes.
Okay, formula milk, right?
Yeah, yes.
Okay, is there any do you change any do you change the formula milk? Maybe before this you use this kind of formula milk and then you change the formula milk.
No, I didn't change the formula milk. I use the
Okay.
usual one.
Okay. Okay. Is there did your son complain of sore throat, flu, cough?
No, there is no symptoms like that.
Okay. Is there any rashes? Maybe.
No, there is no rashes.
Okay. Okay. Instead of vomiting, did your son have nausea?
Oh,
No.
I'm not sure about that.
Okay. 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 Did he complain of um okay, it's okay. What where do you live? Are you living in dengue prone area?
Oh no, my
Okay. No. Okay. Is there any abdominal pain?
oh yes, I noticed. He had
Yeah.
abdominal pain.
Okay. Oh, okay. Abdominal pain. Can you describe more about the abdominal pain? Or when it start? When the abdominal pain start?
So the abdominal pain also start the same with diarrhea.
Okay. For the
Same with
that
diarrhea.
for the 3 days, right? Okay. Okay. Do you notice any loss of weight in your child?
Oh, About that, I'm not sure. I didn't weigh my child.
Okay. Okay. Um. Okay. After having diarrhea, do you did you give your sons any water to restore back the fluid that
Yeah, I tried to
yeah.
give him some water, but
Then
later on he refused.
okay. Okay, do you notice any irritability in your son, of your son?
Yes, I noticed that he cried a lot and cannot sleep.
Cannot sleep. And he also lethargic, right?
Yes.
Okay. Okay. I want to ask. Is this the first admission?
Yes, this is the first admission.
And okay. Did your son ever undergone any surgery?
Oh no.
Okay. Is he on medication?
Sorry, can you repeat?
Is he on medication other than PCM?
Oh no.
Okay. Okay. Um. During your pregnancy, for Afrin, did you have any problems like GDM? Oh,
Yes. During
yeah.
I had GDM.
Okay. Do you do you take the medication?
Yes, I take.
Okay.
I am on diet control.
Okay. Do you have any hypertension?
No.
Okay. Um. Uh, how uh how many weeks uh okay, at what week did Arfan was born?
38 weeks.
38 week via spontaneous or C-section?
Spontaneous.
Spontaneous. Is 38 like today? How many? What is the weight?
3.4 kg.
3.4 kilogram. Is there any complication?
No, there is no complication.
Okay. Okay, did Afan has jaundice?
Yes.
How many
He,
days?
he has jaundice for about 4 to 5 days.
Okay. Is there any treatment that he received for the jaundice?
Mm, I think I don't quite remember.
Oh, okay, it's okay. Uh, um. Okay. Is Afan still on breastfeeding?
No. I
Okay.
stopped breastfeeding
Yeah.
when he was 4 months old.
4 months old, and then you give
I gave formula milk.
formula. Okay, 4 months. Uh, yeah, if you remember when Afan start
begin weaning at 6 months old.
What do you give him?
I give
Or you tell can I know about your son diet?
for now.
Yes, for now.
For now, he's still on formula milk.
Yes.
So he took 7 to 8 ounces per feeding for every 4 hours. And he also take adult diet.
Okay. Before having these problems, your child is good, is it?
Sorry?
Before having these problem, is your child's appetite good? Your child's appetite good before having this problem?
Um,
Okay. It's okay. 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 I want to ask. Okay. For the development, is your child can walk and can speak according to his age?
yes, there is no delay in the development.
Okay. For I want to ask about the vaccine. Did often take all the vaccination?
Yes,
Uh,
the vaccination is complete.
okay. Okay. Can I know how old is you?
So I am 28 years old.
28. And your husband?
My husband 33 years old.
33 years old. Both of you are healthy, right?
Sorry?
Is there any medical illness in both of his parents? Do you have any medical illness? I'm sorry. Can you hear my question? Akila. 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 Hey, sorry, Akila. Sorry, doctor. Akila had left.
Where she is?
I don't know.
Really, the time already finished. If she answer, I
maybe
will
there
give
is.
you 2 minutes. Otherwise, your time already done.
Okay.
Where is your
Maybe
patience?
maybe Akila had internet problem. I don't.
Okay. Adila,
Akila.
Okay, so we can start. If no hope that Adila can pick the line. Can you please present your patient? Make sure that all your colleagues can hear us or not.
Oh, you mean I need summarize the case?
Yeah, all the participants are there. They can hear us.
Yes.
Okay, that's fine. Okay, go ahead, please, and make summary for your consultation to this patient.
Okay, wait a minute. Okay, so this patient, Afrin, 2 years old boy, he come to HTA with a complaint of diarrhea and vomiting for 3 days. So basically, the diarrhea was time 10 times, and the stool was brownish in color, and there was no blood, and it was watery diarrhea. The vomiting, it the vomitus contains particle, and it was about half a cup, and it was non-projectile. Okay, on the second, the patient also complained of fever, but then relieved a little bit by PCM. Okay, due to the diarrhea, the patient had lethargy and decrease in oral intake. There was also abdominal pain for 3 days. Okay, I think that's all. That's all for the summary.
Okay. Do you have anything else you need to add from the history?
Okay. Okay. Due to diarrhea, the patient had decrease in hydration status that present with difficulty in sleeping, and the patient had cried, and the patient cried a lot. I think that's all.
Okay, so what is your working diagnosis now?
Okay, I think it is acute gastroenteritis. Yeah, with decrease in hydration status.
What is decrease in hydration status? What is scientific expression? What is the scientific expression for that?
Dehydration.
Enough? Or you need to tell me, is it mild or moderate or severe?
I think it's moderate.
Why?
Because the diarrhea, because the patient had diarrhea and also vomiting. The diarrhea was 10 times per day, and the vomit, and also had massive vomiting that can lead to dehydration. And I don't think it was severe dehydration.
So you are diagnosing it by history?
Actually,
you are a clinician. So what signs of dehydration you must ask about?
Sunken eye.
Okay. What else? Okay.
Integer.
Okay, what else?
Apa tachycardia.
I will ask you one question. What can kill the patient? The diarrhea or the dehydration?
Dehydration.
Dehydration, because we have a lot of patients who has chronic diarrhea and they are living between us. The difference is they need to go to toilet more than normal, but they are living. The issue for children, especially infants, body surface area is big and they can easily get dehydration, and the dehydration has a lot of complication. That's why your top priority is to define if it's just a simple gastroenteritis, okay, due to virus or like that, or it is a bad or dangerous gastroenteritis, and what is the degree of dehydration. Because with time, I need to see all of you are very good clinicians. They can treat gastroenteritis if they pick it early by just ORS, simple sachet, and try to educate the family how to use it. So it will save life. Whatever the severity of the diarrhea, if the patient still can get oral and has no vomiting and they are trying to compensate. So whenever you diagnose diarrhea, as we speak before, you must define what type of diarrhea did you suspect. Is it infective or non-infective? And what is the degree of dehydration? Okay, Aisha?
Yes.
So you must ask about this in details. Did you feel that your child, his eye is normal or it looks like slightly depressed? What about if he's crying, he can cry by tear or not? Okay, what about his tongue, it's dry or is thirsty and asking for all this? You must put it through the history. What about his urine? Is urination like normal or less than normal? It will guide you. He looks loss of weight or not, because it is a one marker of dehydration, how much loss of weight. So during history, I know that the patient is not in front of you, but you must be able to pick all that knowledge. Okay. So I would like to ask, what is the Bristol score for diarrhea? Okay, now your colleague who is making the role of mom can answer. Both of you can answer, any one of you. The nice mother, what is Bristol?
Bristol 6.
Yes, how can you say, is it 1 or 2 or 6 or more?
Because for a Bristol 7, it is entirely watery, but for the child, it is watery but still have semi-solid.
Okay. So it is very important to tell us how is the Bristol score for that child. Number 2, Aisha, did you ask her how she is doing cleaning for the utensils for feeding?
I'm sorry, Doctor, can you repeat the question?
Did you ask her about general hygiene?
No, I didn't ask.
Is it important?
I think it is important.
Did you ask her about any contact with sick person?
Yes, I did ask.
Is there any contact or not?
There is no PC contact.
Did you ask her she is going to nursery or not?
I didn't ask.
This is the way which you can expose. If she doesn't got a kids at that time, you must ask about the school and Tajika. It is very important. Okay. So let us between you now, who can answer? How can we say, is it mild or moderate or severe dehydration?
Based on physical examination, doctor.
Okay.
First, we look at on his general condition, whether he is alert or irritable, restless, or looks lethargic, unconscious. Also, we look at the condition of the eyes. Is it normal or sunken eyes? Also, we might try to offer the child drinking a glass of water and observe if he drinks normally or drinks with thirsty or in severe dehydration, he was not able to drink. And also the last one is the skin trigger test.
Is it enough? Yes, all these are very important. But what else? If you ask yourself with every patient coming to you, because we are examining you in some patients, but every time patient is coming to you, it is a real exam. Suppose if this patient have severe dehydration, what did you suspect the other criteria you need to check?
Is it urine output?
Can be, yes. What else? What about the vital signs?
Hypotension.
Okay. What is the meaning of hypotension, please?
Which indicates decompensated shock.
Okay. It is a very, very important point. I told you before, vital signs are vital. If you have a patient with dehydration, choose mild or moderate, okay, or even severe, and he still maintain his blood pressure, but you will find him tachycardic, start to be drowsy like that, so you are diagnosing him as compensated shock, okay? If you leave him until became deteriorated and you are unable to secure him, usually he can go for acute kidney injury. I just need to tell you that simple notice from you can save the child. Maybe this child will continue the remaining of his life going to do kidney dialysis 3 times per week because the honorable doctor who saw him doesn't concentrate in the degree of dehydration. That's why vital sign, number 1, hypotension, blood pressure, is there any hypotension or not? But if there is still blood pressure maintained, so I can get clue through the pulse rate. If he started to be tachycardic in infant and children, if he started to be tachycardia, take care, please. It is not simple. Okay. At the same time, if the capillary refill time, is it important? Hello?
Yes, doctor.
Capillary refill time, is it important?
Yes.
It is very important. Okay. And at the end, you must ask about two things, because the degree of dehydration depends on the one of the criteria is the weight loss. So you must ask the mother about the last record of the weight, how much it was, and what his weight now, because if he lost weight according to the age of the infant, can be 5'10", below 5 is mild, 5 to 10 is moderate, above that is severe, but for the children, it is other number like 4 and 7. So it is very important to weigh the child, and sometimes try to ask about input-output charts. What he drank this day, how many times he got breastfeeding or other feeding, how many times he vomited, how many times he got diarrhea. So all this is very, very important, please. Okay, and as I told you, who can answer from outside this group, what is the complication of dehydration or complication of gastroenteritis?
Is it seizure?
Why seizure?
Because in AGE, the patient have a prolonged diarrhea, which leads to the electrolyte imbalance.
So electrolyte imbalance, which can cause a lot of complication. Okay. So number one, electrolyte imbalance. So I must keep in mind teaching the family, because many family doesn't know. If the patient got diarrhea, he is going to lose both water and electrolytes. If the mother try to give him only water, what will happen for electrolytes? It will be disturbed. Hypokalemia can cause paralytic ileus, hyponatremia can cause convulsion, as you said. So it is very important to teach them, please, mom, the best compensation for diarrhea is the ORS. It is came from the WHO, which measures the amount which is lost, and they put it salts and sugar inside that. That's why in some poor area in the world, if you find someone getting severe diarrhea, sometimes you ask him, please put 1 spoon of sugar and 1 spoon of salt in 1 liter of water and try to get it. Don't give your child, he is thirsty. He will drink any water you give to him. So please don't give him plain water, otherwise you will increase the situation by electrolyte imbalance. Other complication?
Hypovolemic shock.
Shock. Yes, hypovolemic shock. Either compensated or uncompensated. What else?
Metabolic acidosis.
Again?
Metabolic acidosis.
Yes, metabolic acidosis. So if you feel the child is drowsy like that, you must go for blood gas. Very good. What else? Maybe disseminated infection. If the child has some microbe like Shigella, Salmonella, whatever, okay, Escherichia coli, it can cause severe septicemia. What else? A very important point, if you left the child without treating the dehydration, sometimes it can end by DIC. And this is a very bad prognostic point. If you found the child started to vomit blood, it means his coagulation profile became disturbed and he went for AGE. That's why you must know that the gastroenteritis is one of the most common cause of killing disease in childhood. And it kills every year millions and millions of kids. So please take care about that. Another Who can answer what is the causes of diarrhea or gastroenteritis? Hmm. Okay, what is the most common cause of gastroenteritis of AGE?
Can it be acute kidney injury?
Sorry?
Acute kidney injury.
No, the cause, the cause.
Is it rotavirus?
Viral causes.
Yes, viral causes is the most common. And the rotavirus is one of the famous one. Can I prevent it or not?
No, eh?
Hmm? Is it preventable disease or not?
We can take precaution.
Yes. Okay, very good. Hygienic precaution. What else? Health education for the family. Okay, what else?
Cooking in cooking inside the cooking at home.
Oh, we are in Malaysia. Be practical. Oh, very important one is the vaccination.
Okay.
Anyone hear about vaccines for rotavirus? So your job is to know now the formal vaccination schedule in Malaysia. You must know it from A to Z, and you will stay for 1 or 2 hours studying it, and it will be finished. But it is not completed because there is evolving vaccines. There is a lot of vaccine like that rotavirus. It is optional one. Okay, and it is given by mouse. And it must be given so early, starting from the 6 weeks, maximum 6 months. We cannot give it after 6 months because there is some researches that it can cause side effect like intussusception. So it is very important to know detail about that because really in the country which are giving rotavirus vaccines, the admission and the death from EGE is less than others. Okay, so your role also, you are not only a doctor, you're also a social person. You must teach them, you must give them offer if they are able to get one vaccine, even if it is a bit expensive, but it is better than admission to the hospital and save their times. Okay. The last one, you must know the composition of ORS, because ORS is a life-saving bottle. It is very important, please. Okay, you must know how much is the concentration of sodium, of potassium, what is the regular one, what is the difference between it and the WHO. If we have different one in our country, it is very important, please. Also, if it is a viral, you must differentiate diagnosis, as I told you before. Diarrhea can be infective, like viral or bacteria. What is the most common bacteria? You must know it. Okay? You must know it. What is the most common bacteria? And at the same time, at the most important to know the most common bacteria that cause gastroenteritis and when we need to treatment. Put beside that other causes of diarrhea. You must go to the history because we have 2 types of diarrhea, known as enteral, which is a problem is in the gut only, and the other one is parenteral. It means the patient has general condition which can cause diarrhea. In the children, like dengue fever, sometimes presented by abdominal pain and vomiting and diarrhea. This is an example of parenteral diarrhea. If some child got otitis media, he started to vomit and make diarrhea. If the patient has pneumonia, he can vomit and get diarrhea. If the patient get UTI, if he got UTI also, he can get the same. So you must be able to differentiate between the enteral and parenteral diarrhea. So you are thinking that you are presenting the most simple case, straightforward EGE, but if you are a good Muslim, if you are searching how to give benefit to the community, how to save their life, you will find a lot of details about classification of the disease, what type, what can I do, how can I handle the family and teach them. This is the top priority. Okay? Now your turn if you need to ask any question. You can open your mic. Hello? What about the session of procedure?
Session procedure. We have done it with Dr. Alwi. Doctor.
You finished it already?
Yes.
Good.
Looking into schedule.
Okay, so I will send you also, or you can ask our science officers. They can go to you because fifth year, they did a very good job and good presentation. Even I can send you the name of one of that group. You can just go through it. It is very helpful, okay? Because you need to hear more than one, because at the time we recognize that at least you observe, inshallah, until opened the hospital again for students, you will practice it yourself, okay?
Okay, doctor.
Okay, thank you. I hope you picked the lesson for your, inshallah, clinical career. It is a good start to be oriented about your responsibility and about the scope of your work. Inshallah, you will be in the top if you start to good and to continue for that. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, doctor.
Welcome.
Welcome. Thank you.
Thank you, Doctor.
Thank you, doctor.
Thank you, doctor.
Assalamu alaikum. Assalamu alaikum.
Waalaikumsalam.
Waalaikumsalam.